Hi everybody, this is Dr. Cho from Korea, and I haven't seen everybody for a long time. I hope everyone's staying safe from Corona. In Korea right now, it's getting better. Our current condition is we don't have too many cases, and I hope everyone else in Asia is staying safe too, and I hope we get back to normal soon. Okay, today I want to talk to you guys about the different types of REJURAN, and also we're going to talk about the new injector that just came out. So today's topic is going to be the use of REJURAN with multiple injection techniques according to different clinical indications. So of course we have to inject the REJURAN, and until now we either do it manual, and it depends on the patient type and the skin thickness, which plane we're going to go in and what angle. But now that we have an injector, I'll explain the pros and cons of manual versus the machine. So I want to talk to you guys about the type of injections we can do. We either do intraepidermic, which is from up until 1 millimeter depth, IDS, intradermal superficial, which is 1 to 2 millimeters, and IDP, which is intradermal up to 4 millimeters depth. Mesoperfusion, which we're not going to do today, is going to be 5 to 6 millimeter depth we do in obesity treatments or other deeper injections. And also there's intrahypodermic, which we also are not going to do, but it's from 6 to 13 millimeters depth. So today I'm going to be focusing on intraepidermic and intradermal superficial injections. So the injection techniques, everyone is a little bit different, and of course we do IM injections for different types of antibiotics, and we also do subcutaneous injections for other injectables as fillers, etc. But today we're just going to be talking about intradermals, and everyone's a little different, but depends on the person and the physician. It's from 10 to 15 degrees. So I've actually seen people do it from 25 to 30, but in general I prefer 15 to 10 degrees. And everyone has a different way of holding it, so it's whatever you like, but in general you want to keep to 15 degrees. So we also have the linear threading technique, and this serial puncture technique. Depends on whether you're going to use a cannula or not. It's just like a filler. If you use a cannula, you inject retrograde. So we're going to show you all the different type of injections I'm going to do today, either manual through the injector and also through the cannula. Okay, so we're just talking about REJURAN. Everyone, I'm sure everyone's using it right now, so I'm just going to go really quick. We all know REJURAN is a 2 cc product in one syringe. It's a PN with 2%, and it comes with a 33 gauge 4 millimeter nanometer needle. You can also get the 34 gauge. Sometimes I use that with patients who have too much, who are too insensitive to pain. But in general, I like to use the one they give you. So I change needles halfway through. I know some people like to change needles, 4 times per session, but personally I just use 2 needles. We also know the viscosity is from 50 to 60. And we also know the pH is from 6.0 to 8.0. It's a medical device, and up until now I've been using just this product, but more and more I've been using the INS. It depends on the patient and the clinical indications. In past I've been using 90% REJURAN and only 10% INS, but now in my clinic I use 70% REJURAN and 30% INS. I'll talk about that a little bit later. So we know the properties of the PN is high affinity to water, and has a long polymeric nucleotide, and also it deals with ECM restoration, and also very important is that there's no allergy reactions with this product unless you use a cross-linked filler, but in general I've never seen an allergic reaction to REJURAN yet. So the reason REJURAN is so helpful to us is because in the end it's going to cause tissue regeneration and wound healing. The way it does this is it decreases the inflammatory cytokines such as TNF alpha and IL-6, and also increases the anti-inflammatory cytokines like IL-10. So it has anti-inflammatory effect, and also it helps with microcirculation improvement. So in general, with the other injectables, it produces collagen, but the thing is that it could cause the good thing about REJURAN is when other patients come with sensitive skin, you have worry when you use an X product because it's going to cause more sensitivity. But this product, in general, is very safe. It doesn't cause any cross reactions. It actually causes the skin to become thicker. So in general, the patient becomes more healthy, and in the end, she's going to have a more healthy skin and a happy patient. So we know that the REJURAN viscosity, I is less viscous, then REJURAN is more viscous, and REJURAN S is the most viscous of the products. So we see the three products. Of course, we just use REJURAN for the overall face, and we use I, for me personally, just for the dark circles and under the eyes and the crow's feet. And sometimes, if the patient is too sensitive to REJURAN, I'll just use 2 to 3 REJURAN I, which I don't recommend, but if the patient is too sensitive to pain and does not want to go under propofol, or in general she's just too sensitive, sometimes I'll use the I, and I just explain to the patient that you have to use more sessions and more product and more cost. So and maybe when I see like maybe 100 patients, I'll have 1 or 2 patients who I just use REJURAN I, but I have to use at least 3 boxes. And with the REJURAN S, I like to use it with a fractional laser, whether it's a Pico or a BEAUMED, because I like to use it with the box scars and the sunken scars. So more and more REJURAN, I've been using it for other indications other than rejuvenation. And we also know that the REJURAN with the S and I, I'm using cannulas more often now, because the patient, if you use cannula, they're less prone to the pain, and it's a little bit faster. So I'll explain that later at the live demonstration. Okay. We know if you inject superficial REJURAN I or REJURAN S, or even the regular REJURAN, after 24 hours it should be going down. Even the S, which is more viscous, after 24 hours the lump should be gone, and after 7 days you should not see anything. I've actually had only 1 case of REJURAN lasting 2 to 3 days, and that patient is, I actually have the picture, very abnormal, but the patient, after we did REJURAN with her, the lumps didn't go away for at least 2 days, but after the 3rd day it went away. So in general, it should go away in 24 hours. Okay, I want to talk to you guys about the BEAUMED injector. So I'm sure you guys know about there's different companies with different injectable devices, especially in Korea we have so many. And I actually have other injectable machines here in my clinic. But the BEAUMED just came out. I've been actually doing clinical research and counseling with the company. I've been using this machine off the record for maybe, I think, 6 months now. It's actually pretty good. It's very portable, so it's very handy, and actually it's less painful than the other injectors if you have other injectable machines in your clinic, so you can compare once you either have demonstration or it comes to your country. So it's really easy to use, and the good thing about this machine is that there's little loss. The very important thing is the pain, of course, is important, but for us, if there's loss of the product, then the patient will have not desired effects, and the patient will complain. So handy is good, and it's less painful for the patient. Everything's good. It's easy to operate, but the most important thing for us as doctors is that there's minimal loss. I think less than 5%, and it's very user-friendly. So once you get the hang of it, because there's no suction, so very easy to use, and after maybe 1 or 2 times, you're going to be expert using it. So David from Pharmacy Research will explain a little bit later, but there's 2 modes. There's one mode, P1, which is fast, and P2, which is slow. So when you first start out, you can use the slower mode. It takes longer, but you'll have less error. And I recommend using, I use P1 in the mode number 4, which is, it comes out in 80 shots for the 2 cc, which comes to 0.25 micro per shot. So full face, 80 shot, you should be able to cover. A little bit bigger face, you might have to use more product, or decrease the micro with how much product you have per shot. And so I'll explain the machine. It's less than 5% leakage of the medications, which is actually good, and it has accurate injections, targeted layer. So is very vast and minimal injection pain because it comes with a 34 9-pin needle, so it's less painful. We've actually had tried patients with no numbing cream. Of course, it's painful, but they said it's less painful than just using the manual method. So patients who are sensitive to pain, I'd recommend you try to use this product, this machine with the product, so patients will be a little more happy. Okay, so this is just a table to show you how much at each level, how much product will be coming out. So I use level 4, but depends on the patient. If you have a bigger face or you want to do less product, you can use level, lower level. Okay. Also, the good part of BEAUMED is after you do the injection, they're going to have minimal downtime. Even if you do the manual, you're going to have minimal downtime. But since this is the the higher gauge, after maybe 2 to 3 hours, they're going to be returned to normal. And by nighttime, they're not going to see any indication, evidence that the procedure was done. On occasion, if the patient is taking omega-3 or aspirin, you might have a patient who has a little bit of bleeding or a little bit of bruising, but it's very, very rare. Okay, so in general, doctors and stuff, we're going to say, should I buy a mesogun? It's going to cost money, or should I just do manual inject? Even though I have the mesogun right now, I like to use, it depends on the patient. If the patient is more prone to pain, then I will go try to do the mesogun. But if the patient is not prone to pain, I will use the manual injection. And sometimes it's good to give the patient options. Try manual, because one session of REJURAN is not going to be enough. So usually in my clinic, I recommend 3 to 5 sessions. So I give the patient option. So the first session, I do mesogun, and the second session, I'll do the manual. And in general, I prefer to use the manual because that's what I've been using for so long. But as I get more and more comfortable with the mesogun and see the clinical evidence, I might switch. So my next lecture, since I do so many cases of the REJURAN, I'll give you guys feedback on what my patients think and what I think when I have more cases. But the bad part of the manual injection is that first you need more expertise, and the depth control is a bit difficult because if you're not familiar with the product or you're not familiar with the skin, it's going to be more hard if you're a beginner to find the plane of injection. There's more bruising and more time consuming. But compared to the manual injection, the mesogun is faster. In a sense, it can be more precise because it's going to be at the same level each time, and it's going to be consistent depth of penetration. It's going to be easier to use. It's going to be less painful and less downtime. The mesogun comes with 2 different types of 9-point needles. It's a 34 gauge. The depth is 0.85 for women and 0.1 for men. So you can either interchange whatever depth you like. If they have thinner skin, use a 0.58 millimeter. Thicker skin, 0.1 millimeters is going to be good. So, and also I'm going to be explaining the use of cannulas. When I use cannulas in my clinic, of course I use them for fillers also, but I also use it for the REJURAN SNI. If there's a large scar area with box scars or ice pick or etc., sometimes I use the cannula because the patient is feels more comfortable with the cannula because it's less painful. The advantage and disadvantage of cannula use is very clear. If there's a large area, of course, you can think about using the cannula, and the periorbital area is less painful if you use the cannula, and then also you can use it because it's less bruising and less time consuming. But the needle is more, you can use it for subcision, but the needle can cause bruising, and you can, there's other disadvantages. It depends on the patient, the area that you're going to treat, and also if you're going to have to use subcision with it. So sometimes when you use subcision, as you know, you can use a Norcor needle, or you can use 20 gauge, 22, 27, depends on the depth, thickness of skin, what kind of patient I have. So through our subjects, I'll explain a bit more later. Okay, so in terms of excess pigmentation, we like to use, of course we have to use lasers, but also use REJURAN eye also, because if you use the eye, it'll make the clinical effects come faster with less treatments. So with this patient, we use, I like to use KTP lasers and also long pulse 1064 Nd:YAG. So especially in Asian countries, especially Korea, melasma after melasma, what patients want to get rid of is dark circles, which is not easy. Dark circles is not easy because it depends on your condition. If you have a really tiring day, you smoke, you drink alcohol, you see a lot of sun, then you're going to have darker eyes at night. So it depends on your aging, genetics, excess pigmentation, tear troughs, intraorbital fat herniation, thin translucent skin, etc., etc. These are all causes. Allergies, etc., will cause your dark circles, especially in Korea. So this is just a deep tear trough. We can use REJURAN eye here too, and we can also use lasers. This is fat herniation. You can also use REJURAN eye and also other different lasers, but lower blood flow capacity is good for these type of patients. It'll make her condition actually better with the surgery. Skin laxity, you can also use this different type. This is actually a cause of dark circles also. Dark circle treatments in my clinic, I like to use the KTP, as I told you before, the long pulse, the healer. Sometimes I use a lightly cross-linked HA filler, the PRP sometimes, and multivitamin skin booster, because if they have an important function such as a wedding or they're taking pictures, the multivitamin skin booster will have the effect faster, but then it'll go away faster. So explain to the patient it's only temporary, but if they want to have a good photogenic appearance, then I use all these different type of procedures here. So this is just, we have a doctor who used in Korea, Dr. No. He did using 1064 fractional picosecond laser and also the PN injection, and it shows after 6 treatments improvement of scarring. Actually, he used the same laser that I used. I used a Discovery Pico, 450 nanometer Pico laser. It's actually pretty good. Dr. No used 0.7 joules, multiple passes until pit K formed, and there's some swelling, but after 6 treatments you could see that visible improvement in the scar. So the different type of acne scars we have is there's ice pick, rolling, and box scar. And the fascia is in the very lower part of the picture. So the reason that the rolling scar is easier to treat, I think, is because if you just release the tension of the fascia, it'll become improve faster than compared to the ice pick or the box scar. So this is just an example of what the ice pick scar is and how they form. Usually they form just in the epidermis, they're less than 2 millimeters, and they're punctured ice pick appearance. And I like to use TCA 70% to 100% depending on the patient, the skin texture and the skin color. So I like to use the PCA dot peel, and also I like to use the BEAUMED and the needle RF, of course with the REJURAN also. Of course, in my clinic we focus on energy-based treatments with the lasers, but also I've been using the more non-energy-based treatments more and more with the subcision, the dermabrasion, microneedling, dermal fillers, chemical peels, and of course with the REJURAN S. Okay, with the subcision, I like to use the bevel up towards the skin from using a needle, and I'm sure you guys all use a Norcor. But if I use a Norcor needle, I like to use a tumescent with epinephrine and lidocaine, because there's a lot of bleeding and also swelling can occur. So I like to use from 18 gauge to 27 gauge needle, and the target is the deep dermis. The objective is to release reverse brands at the dermal or deep dermal subcutaneous plane. It is the most effective for the rolling scars. You cannot try to use this for the ice pick or the box scars because it's not going to help. It's too superficial. So just to show you a picture of how we do it, once you do the subcision, you're going to feel the fibrotic bands release through your hand. So it's very effective, and I like it. I like to use multiple treatments. I like to do them from 3 to 4 weeks interval, at least 3 to 5 sessions, along with the REJURAN. Precautions to avoid a subcision. You want to avoid nerve injury, of course, preocular area, the temporal area, and the mandible area. Hematoma and bruising can occur, but you explain to the patient, they should be okay with that. If the patient has thin skin or you're worried about swelling, you can use a tumescent, just a little bit at the puncture site. Okay, this is another JCD, the Journal of Cosmetic Dermatology. It's just an article to show you that blunt cannula subcision is more effective than Norco needle subcision for acne scar treatments. But the doctors who, I read the article, doctors who did the study, I don't know if I necessarily agree with them. Sometimes I like to use a Norco needle, especially with the thicker skin and if it's a young male. But if the patient is older, thinner skin, of course I prefer the blunt cannula. Of course there's much more sessions. I don't know if it's more effective, but in general in my clinic, people do not like to have bleeding and swelling, so I prefer the blunt cannula technique with the women. Okay. Also, I use a lot of the TCA peel in my clinic, so I like to use the deep, which is above 50%. I don't use phenol. I don't know if you guys use phenol or not, but in Korea, phenol is not used too widely these days. With the TCA peel, it's very effective. There's a reason it's been around so long and it's not going away. But the problem with TCA is that it can be painful and redness can develop. I've never had cases of hypopigmentation, but there are cases of this. The main focus for Asian skin is either we're worried about the redness, and also sometimes you could have PIH if you use too strong of a dose and if you get it into the normal skin. So in my clinic we use 70 to 100% TCA depending on the person and the skin type. Okay, this is our staff, and we did a REJURAN eye with a manual injection. So we make the patient look up. It's easier injecting for us, because if the patient looks down or just closes their eyes, it's harder for us to inject. But if your patient looks up, it's easier for us to inject, and also we're not going to miss any areas that we want to get into. Okay, also you can use the REJURAN eye with the cannula. We do the puncture, then you insert the cannula with the bevel up, like this, and you use 0.5 cc with each side. And with these, with the REJURAN eye, this is our staff. Next morning, with the swelling, it all went away. But she told us, in general, we tell the patients that if you use a cannula, the swelling could last 1 or 2 days, but in general, it should be gone in 24 hours. So this is another patient we have. So this is before and after using manual injection and cannula with the patient. On your left, we did the manual injection. On your right, we did the cannula. With this patient, after 2 hours, very minimal swelling, and actually this is after 30 minutes. So very minimal swelling, and she didn't have any side effects. Okay, this is another patient, this is another, this is actually a staff. So this is another one I like to use. She has a lot of ice pick scars, and she also has some rolling scars. She's 23. When she was younger, she had a lot of acne problems. So what we do is we use a Discovery Pico. For this patient, I use a 0.4 joules, multiple passes until ending point is petechia. And after that, I use the REJURAN S with the cannula to release the fibrotic tissue. This is another staff of mine. She has some scars. So what I like to use, I use a TCA peel, and you can see that the whitening on to your right. And then I use the REJURAN S with a manual injection right on top of it. This is another patient of mine. I like to use the TCA peel and also the REJURAN S, multiple treatments. I think for this patient, I did 3. Okay, this is another patient. I've used the chickenpox scar. So I had the dot peel with the subcision with the REJURAN S. Okay, this is just another recent patient of mine. This is just a REJURAN that shows you that I did she didn't want to do any lasers, so just 3 treatments of just a regular REJURAN, 1 month apart, and her rosacea and her seborrheic dermatitis went away. Okay, this is another patient of mine. She did Discovery Pico with the REJURAN S. This is a manual injection after 3 sessions. Okay, this is another patient of mine. This is after 5 treatments. We did acne scar reduction with a needle RF. the BEAUMED photonal laser, and the REJURAN S. With this patient, I did manual injection for each scar, and for this patient, I had to use two cc's each treatment. Okay, this is another patient with a keloid scar. I used the REJURAN S with the BEAUMED in the subcision. Okay, thank you for your time. And if you have any questions, I'll answer your questions after we do the live demonstration. And we'll start right now with the live demonstration. And then afterwards, David from Pharma Research is going to explain a little bit more about the BEAUMED injector. And today,
yes, we have a question from B that they're asking about the comparing REJURAN product with the another PM product from other company.
Mm-hmm.
They want to know what's the difference between those 2% of PN compared to another company contains a 0.5% PN. So they want to know the disadvantage and advantage between the REJURAN and other company products.
Okay, that's a good question. As you know, of course, I do lectures with Pharma Research, but we also get PNs from other companies too. A lot of Korean companies are coming out with skin boosters with PN, not PDRN, PN skin boosters, PN injectables too. From my experience, it's same with everything. With the fillers also, if the HA is too high, you're gonna have some allergic skin reactions, or you can have some problems. I believe that 2% is just. I've actually never had used a product above 2%. I've tried PNs with 1%, 0.5%, or 0.5, 1, and 2. I've never seen anything above 2, but to be honest, I'm not sure why. There's a reason they're not using above 2%, but I think they're not using above 2% is because there's more allergic reactions or more side effects. But 0.5, I think, is too low. Too low. So, and I think the 0.5 is I don't know why they're using 0.5, but just to show that they have PN. PN is good, but in my opinion, it has to be over 1%.
And we have another question that REJURAN Healer gives the same result as REJURAN S, atrophic scars with the subcision techniques, and the same question goes with the REJURAN Healer and REJURAN I. That's
a good question. The reason, to be honest, I've tried using REJURAN with the cannula under the eyes or with the scar. If you use a regular REJURAN under the eyes with a cannula, it's going to last over 24 hours because it's more viscous. The reason I use the eye is because it's, to be honest with you, it's only 1 cc and it's cheaper to buy for us because you're not going to use 2 cc's under the eye, and it's made for just indication under the eyes. But if you're going to use REJURAN for the whole face, I don't think you have to buy the eye. Just use a little bit more under the product here, then you can just use it that way. With the S, it's more viscous. You can get away with just using a regular REJURAN with the scars, but patients nowadays, they want more specific products for their specific needs. So in general, I'd recommend using the S for the scars, but for the eye, if you're going to use it for the full face anyway, you don't necessarily have to use the eye with it, but you'll get to be honest, you'll get the same results if you just use a regular REJURAN here. But the S for the scars is a little bit, I think it's a little bit better results here with the S, to answer your question. Now we're going to start with our next patient. This is actually the same patient we did with the last seminar. She did a manual injection, and she said that even after one treatment, she had pretty good results. So today we're going to try the BEAUMED injector. But before we inject, we're going to give her 2 stress balls with REJURAN. And then also, I'm going to mark the problem areas for her. And by the way, the REJURAN is going to give this as gifts to all the participants today. So this patch is actually good. I'm going to ask them for a lot of these. It has blue on one side and white on the other side, so it's actually pretty useful. Good idea. Okay, so I've seen this patient. She's actually in her early 20s. I've seen her. That's how old I am. I've seen her when she was in middle school. Now she's a college student. So she has, when she was younger, she had atopic dermatitis, and then she also has some PH here around her perioral area. So her area of concern was that she had some eczema here and PIH here. But after one treatment, she noticed that it got brighter and she has less itching. So actually, REJURAN is also for the beauty, but also it helps with skin disease also. So her other areas of concern is that she has a little bit of rosacea here and here, and some dry skin. And she also has dry skin, which is actually got better. So we're going to try to treat all these areas for her today. So before we treat, I'm going to sterilize her face, sanitize her face one more time. And since she had the manual injection last time, we're going to try the injector today. Okay. Okay. My staff already prepared the injector. So the P1 and level 4 with 25 micros per injection. It's very portable, so it takes, I think, 3 to 4 hours to charge it, and it goes all day. So you can use it. At least I've tried 4 or 5 patients without charging it. It's okay. Okay, so this is a 9-point, 34 gauge needle, 0.58 depth, and we're going to start. Okay, with her, I'm going to start down here. And if you see the needle here, I'll just release the product one time. Okay, you see a little bit come out. 시작할게요. As you can see, very little loss of product. The only time you're going to get lost is if you get in a hurry and you pull away too soon. If you wait until the motor sound ends, you're not going to experience too much loss. And always remember to tell your staff to anesthetize until the corners, because if you do not apply the lidocaine here, it's going to hurt. And also, whether you prefer it or not, some people like to press down on the skin like this, and some just like to gently, like that. I prefer to put a little bit of pressure on the skin. Another time you get lost is if you're not perpendicular to the plane. So when you inject, if you wiggle, or you are at an angle, then you're going to get some loss.
Dr. Cho, we have
Yes.
a question from the,
Yes.
the participants that they have two questions.
Yes.
They say, is it still effective to treat dark circle of eye using the REJURAN, not REJURAN eye?
Yeah.
Also considering that many patients like to get injected all over the face, including under eyes,
Yes.
rather than just the eyes itself.
Yeah.
And the second question is there any case that allergy in REJURAN injection if the patient who has a seafood allergy?
That's a good question. Even if the patient has seafood allergy, because we do the masked allergy exams here, I haven't had one case of allergic reaction. The only case of allergic reaction I've had is when you use cross-linked filler. So even with a seafood allergy, I think it's very safe. And what was the first question?
They're asking about the treating the dark circle eyes.
Yes.
Using a REJURAN, not REJURAN eye.
Yeah.
Is that effective?
Yes, it's effective. It's just as effective as eye. It's just that it's effective, but as I told you before, if you want to be more specific just to the eye area, the reason we use eye is because it's less painful than the REJURAN. So if you're going to do the whole treatment and the patient you're worried about cost, then of course you can use the REJURAN. Is effective, but it's more easy for us to use with the eye, and also it's more specific for the eye areas because you can get more of the product in there.
So Dr. Cho, which
Yes.
needles do you using at the moment?
Right now I'm using the 34 gauge 9-point needle with 0.58 or 0.85.
85.
Yeah.
So that's for the woman who has a
Yes. Thin skin.
skins.
Yes. So
So did you feel any the leakage?
no, there's very little leakage here. So, but to be honest, this is P. This will usually take around 5 to 10 minutes if you use P1, I think. 너무 잘 참네요. And this is disposable, so I wouldn't recommend reusing the needle. Some people, they reuse it, but I prefer just to use one needle and throw it away. 아프죠? And also, even with the REJUMATE, I mix Botox together with this, and I also mix sometimes other things also. So you can mix other products with this. It's very comes in handy. So are there any other questions?
The last question was the people asking, can we use the micro cannula for size 25, the administration in REJURAN? Because sometimes the patient, they didn't convert over the multi-needle injection, multiple injection.
So do you want to use 25 gauge?
Yep. Microcannulars.
Yeah, you can use 25. I'm going to use 25 today. I'll use today. I'll show you.
And also, we have another question that like people keep ask, questioning about those. Can we mix REJURAN with the crosslink HA?
Yeah, I do it. I to be honest, I do it, but there's certain patients that you should avoid. When you look at the patient, if you see a lot of clinical experience, if the patient already has a lot of rosacea, sensitive skin, they're more likely to have a sensitive reaction to REJURAN with the filler. So I'd recommend with these type of patients, if you're going to use it, after the treatment you give them oral steroids or you give them steroid IM, dexamethasone IM. But if you're a beginner using REJURAN, I'd recommend you just don't use cross-linked at first. Once you become comfortable with the product, you use it a lot, try it with the non-cross-linked first, and then if you're comfortable, then use slightly cross-linked. There's a lot of good products out there, so slightly crossed.
Okay. And we have another question about the BEAUMED. How do you calculate the volume left on the syringe? How to divide it evenly before and left and the right side on the face?
Oh, that's a good question. Actually, the pharma researchers are going to give you a table. It shows you exactly how many shots you have. So in general, 40 shots like this. But you could make it up to 100 shots. With my men with a bigger face, of course, you have 100 shot. So you just, in general, you look at the syringe too because you can see it. So you can see how much you're using. So after like once you see I'm almost half done. So in general, it should be enough. Right now with her, she has a normal face. I just have a little bit product left, but it's enough for the forehead and just enough for it's just a regular sized Asian face. I think 80 shots is okay.
80 shots for 2 mils.
Yeah, 2 mils, yes. Okay, so we're finished. So we're finished with her, and afterwards what we're going to use is the REJURAN soothing mask for post-care, which is right here.
The white one.
White one right here. Okay. So afterwards we're going to give her just a post-care of this, and it's going to help reduce the redness and the heating sensation afterwards, and she'll be good to go in a couple hours. Okay. For the next patient, I'm going to give her stress balls before I forget. Hold these. Okay. Okay, for this patient, her area of concerns was she came us for pigmentation, and also she wants to have some treatment for her dark circles here. Okay, and also when she was younger, she had a scar here. Okay, so that's what treatment. She also, when she was younger, she got a mole removed with the CO2 laser, but she has a keloid condition, so a keloid lesion formed here. So those are 3 areas that she wants to be focused today. And the lasers we're going to do next time she comes to clinic, but today, because we're doing live demonstration, we can't do the laser with the REJURAN together. So today we're just going to be focusing on these 3 areas. Okay, so what we're going to do is one side I'm going to use the cannula, and one side I'm going to use the manual injection for the REJURAN I. And for here, with the scar here, I'm going to be using the REJURAN S, and also I'm going to use subcision with it together. Since this is not an ice pick scar, I'm not going to be using the TCA peel. I'm just going to be using the needle that the REJURAN gives us for the subcision, and also inject the S right manually into the lesion. Okay. So what today I'm going to use is I'm going to use the REJURAN I, and I'm going to connect it with the 25 gauge cannula. Okay, so you could either use 25 or 27, whatever you prefer. So I'm going to be doing the cannula on her left side. So I'm going to sit here. So everyone can see. So I'm going to make a puncture here. For the periorbital area, if you puncture too close to the eye, or this area right here, that's where I generally see most of the bruising happen. So I like to go a little bit more lower than here, because in Asian eyes, usually all the bruising comes right here in this area, 2 millimeters from here. So I'll mark it again. Bruising happens here. Everything happens here. But as you know, if you guys do thread lift in your countries, I like to use this area for the thread lift because that's where the vector is good for the skin lifting, right? But this is not thread lift, so I don't have to use this area if I don't really need it. So I like to, if you will, I consider this danger zone for bruising. So I like to go a little bit deeper here. Okay. Lower actually. So I'm gonna just have a little prick. So start perpendicular. Just give her a little prick. Okay. Okay, and you want the bevel up, not down. Usually cannulas have an arrow here, so it shows you which area is up, okay? So you want to start perpendicular and just go back and forth. Okay, she has a little fibrotic here. 여기 뭐 시술한 적 없죠, 여기는.
So Dr. Cho,
Yes.
some of the questions come up. They're
Yes.
asking about the, would you consider adding the microneedling for dark eye circle as well?
Dark eye circle, microneedling?
Yep.
What do you mean by microneedling?
They're asking just, what do you think? And would you consider adding on microneedling for the dark eye circle as well? Which means that, the microneedle.
Well, depends. I prefer if you go like this, for this, you tent it. Go back and forth, you tent it. Okay, she has some fibrotic tissue, so you go back and forth. As your question for microneedling, in terms of eye, you're talking about
Dark eye circles.
dark eye circles. I prefer, nowadays what I like to do is I do double. So what I do is I'll actually show you exactly what I do in my clinic. Okay, right now she just finished with the eye treatment with the cannula. So in my clinic, what I like to do is after I do the cannula, I put the REJURAN on top here, double. I use double. So I get right under the skin and I also go below. So I like to use 0.35 under the skin and 0.15 above the skin. So I could do it that way. So in general, before I always just do under the eye with a cannula, but nowadays I've been, with the clinical experiments, I've been noticing I've had better results if I use above the plane and below the plane also. So it's much better.
So how many millimils do you inject it to the eyes?
No matter what, I use 0.5, 0.5 on each side. I don't go over 1 cc. So now I'll explain. 우리 아이 하나만 더 주세요. Okay, I'm going to have the patient look up. 위에 보세요. I go right under the skin. You stretch the skin out. You get as close as you can. Okay, we're finished with one side. So this side is exactly how I do in my clinic. I go under with the cannula, 25 gauge or 27 gauge, and then right above it I do manual injection. Now I'll do the other side. See, if the patient does not look up, it's harder for us to do it. But if you make the patient look up, much easier. 위에 보세요. See, it's the patient is a little bit more uncomfortable, but then with your non-dominant, less dominant hand, if you pull down on the skin, much easier to use. So this is a relatively safe and easy procedure. You finish in 1 or 2 minutes. Okay. So she's finished here. And now we'll use S. After we finish, we're going to have her sit up and we'll see the difference between the swelling with a cannula and non-cannula. It shouldn't be too noticeable. Now we're going to use the S. Okay, with the S. Since unfortunately she doesn't have too many scars, but the one that she does have, I'll show you exactly what I do in my clinic. Okay. Then I stretch the skin out. When you stretch the skin out, you can see the lesion more carefully and more precisely. The hypopigmentation you can do really nothing about because it's already formed, but with the depression you can help fix it. Okay, so what I'm going to do, I'm going to approach it from the top like this and do some subcision. Okay, there's some fibrotic tissue here. I could hear it and feel it going away. Going back and forth, the skin becomes more smoother, less fibrotic. Now I inject. Okay, it's finished. And I'm looking for any other lesions. That's it. Now we're going to have the patient sit up. 다 끝났어요. 고생했어요. Okay. Okay. As you can see, there's, even if you use a cannula, there's not too much difference in the swelling. You will have it a little bit, you can have it with some patients a little bit more, but this should be going away in like 2 or 3 hours. So after we use the REJURAN calming recovery pack, she should be, mask pack should be okay. Okay, now we're finished with the demonstrations. I'll answer some of your questions. We will start with the question was how do we combine REJURAN and TCA in acne scar patients? Because it's hard to perform intradermal injections to ice fix scars. That's a good question because it's so superficial. But what we do is when you can't, since it's so superficial, you have to do this manually. If you go manually, what I'd like to do is with ice fix scars is you tint the skin like a cannula with a needle, and you go right under the ice pick scar. So that's how you make a bled. That's how I do it. And after that, I like to use a TCA scar before the injection. So you TCA dot peel first, and then what I like to use with the TCA is some people like to use a toothpick. I don't like to use a toothpick. I like to use a BD syringe, 0.5 BD syringe. I just take the TCA peel out a little bit, and then I make it. You gotta have a good hand, so you drop the TCA peel right on the lesion, and then after you see the frosting, you take the needle and you tint the skin, and you inject. And the next question was, what is the minimum depth of this needle, and is there an age limit for REJURAN? The earliest I've done REJURAN is 12, 13, and the reason we did it for that patient is because she had atopic dermatitis and her skin was so itchy, and she wanted, it was red, erythema, and rosacea. So I tried someone who's 12 or 13, and she's actually pretty good with the pain. That's the youngest I've done it, and the minimum depth, as you know, is 0.58, 0.85, and it's going to go intradermal. If it's not injected intradermal, will the result be the same? Yeah. If you go too deep, you're going to use a lot of it product also, and then plus you're going to go if you go too deep, you're not going to get desired effects where the ECM junction is. So you got to go intradermal for the best effect, and plus you're going to use less product. So the next question is, if the eye area we use papilla technique on the face, can you inject in the upper eyelid? Yes, you could inject in the upper eyelid, but I've tried it. To be honest, I don't think it's as effective as infraorbital. So unless you see a specific lesion in the upper eyelid that you want to get fixed, I do not recommend the lips or the upper eyelid, in my personal opinion. Okay, so when you consider micro needling for the dark circle as well, if you're thinking about MTS, is that what you're thinking about? I wouldn't waste the product using MTS for dark circles. If you're going to use that, you should use D-Cell or another product. Uh, if you're talking about microabrasion, that's what microneedling is. If you're going to use MTS, auto MTS, or microabrasion, which is, I think, if you guys talking about the same thing. So, is there any other questions?
If you guys have any questions, please share us your questions, and Dr. Cho will answer all your questions.
How many milliliters can we use on this? Which scar are you talking about?
Okay, I think it's gonna be end the session. What we're gonna do is sign,
Okay.
reading,
I want
say
to.
goodbye.
Okay. Okay. I want to thank everybody for spending more than an hour listening to the lecture. If you have any questions, please ask Pharma Research, and I'll try to answer all your questions as the best I can. And stay safe. I know it's a difficult time for everybody with COVID. Korea's getting better. I hope your country is getting better also. And I think we have one more question. What is the pathophage of TCA post-inflammatory everything? Is it similar to PICO causing? No, actually it's a little bit different with the TCA. I think it's different. How do you use REJURAN to treat PIA, resistant PIH? I think this was missed twice. Okay. Of course I use REJURAN to treat PIE and rosacea and PIH. The patient that, actually I should have showed you guys her before and after pictures of the first patient, the young lady. She had, from having too much eczema as a younger child, she kept itching her skin. So she had a lot of PIH here and dry skin, so it was really dark. But even after, I think I did treatments with her, the PIH actually went away pretty fast. So REJURAN is actually good with the PIH when it's in terms of if it's disease related. But if it's pH related to melasma, REJURAN will help, but you're going to need multiple treatments. And sometimes I use duransamine or other anticoagulant injectables with it, mixing. In terms of the PIE, the TCA causes the the scar to actually collagen stimulation to come back up, but it's different with the pico laser. The pico laser, it goes deeper, as especially with there's also pico shore, there's also discovery, all these 1064, but it's a little bit different. The pico goes deeper in the skin, which is different from the TSA, which goes more superficially. That's how I think the best way to think about. That's how it works.
There are a questions coming up.
Okay. How much Botox do you use when you mix REJURAN? Okay. With the Botox, I mix anywhere, I think around 20 to 30 units, which I like to use. Have you ever displayed? Of course, I've had delayed allergic reaction to REJURAN. I've had it one time come up after 2 days. It's very weird. I still have the picture actually from that. But after I used dexamethasone and oral steroids for 2 or 3 days, it went away. I've had one experience with that. It was weird. The papules didn't go away for more than 2 weeks. Did you mix anything? It shouldn't stay for 2 weeks unless you mix. Or did you try mixing with another ampoule? No, I've never tried with biotin ampoules with the REJURAN. Okay, for treating the REJURAN with the acne scars without any of the laser modalities, you're gonna have a tough time because as I told you, it's with the TCA and also with the Pico, it's treating different level of the skin. So if you're going to treat acne scars with the REJURAN, it's going to get better, but you need subcision, and also with the REJURAN, also I always recommend using lasers. And depending what kind of scar, ice pick, box scar, or rolling, you're going to have to use lasers. If you don't use the lasers, you're going to need too many sessions, and it's going to be too expensive for the patient. So you must use combined therapy. And PRP mesotherapy. The PRP, before I used REJURAN, I used a lot of PRP. With the PRP, it's good, but yeah, it's good. But the trend, the trend now is not to use too much PRP anymore. The PRP is okay with the skin texture, but with the scar, I prefer using the REJURAN. It's a little more effective. If you just use REJURAN only and it lasted 2 weeks, if you ever have a chance, can you send me the picture? So I actually, it's very, I've never seen it happen for 2 weeks. And combine, yes, I do combine REJURAN and PRP. I've done that in the past with, for single session skin removal. It's actually pretty good. The PRP, if you use it with the REJURAN, the patient will have the effects come a little bit more faster, but it is a little bit more painful for the patient. Just explaining the pain, a little bit more painful, but I do combine PRP and REJURAN. And a lot of Koreans, we used to call this honey REJURAN because the PRP color. So we used marketing, a lot of people used in the past call it honey REJURAN with the use of PRP and REJURAN. And also the length of the REJUVENATE, what is the length of the REJUVENATE?
0.85 and 1 mil. There's 2 types available.
Yeah, that's the gauge. What about length? The
length. Yep.
0.85. What we have is 0.85 and the 1.0 here. You're not guys going to make any more, right? That's it.
No, those are 2 types.
That's the types. Okay. Okay, everyone. Thanks again, and I hope to see you soon. And if you have any more questions about the injector, you can ask from research, or you can ask them about my clinical experience. And talk to you soon. Thank you.
Hello everyone, just the last section. I'm just going to briefly introduce our REJUVENATE. My name is David. I'm going to explain to you how to assemble this product, because a lot of people knows that, showing the injection technique, but people just wondering how to assemble this, the inject. So let me show you how to assemble those injectors for you. So this is a general REJUVENATE healer products. So all you have to do is you have to make sure that your the plungers take out, and this out. So as you can see, this is the shape of the REJUVENATE healer. So this is the REJUVENATE gun, REJUVENATE. So you have to make sure that there's on the buttons in here, you may see there's the pull up and down. So up and down. So you have to make sure that like your the plastic the load is coming up and down. So you just make sure that this goes up and down and connect it on the turn round on the upside down upside to the left side to the, make sure that it's a click on well, and pull, just to make sure that pull down. You have to press the pull down buttons. Make sure the syringe touch the end of the so you can see this is the the assemble sounds, and you have to put the filter with the tubes, and then connect it. So then after that you pull out the needles and take the top of the caps out and connect it to turn right to make sure that everything is fit well, to make sure that is the right figure, to connect it again into the needle with the filters. So that's the symbol. So it's quite simple. So all you have to do is take this cap out. Make sure there's the little the bubbles, the air. So all you have to do is you press the up to make sure that liquid's going up, and see the needle shows the liquid. So that is ready to go. So that's how to assemble the BEAUMED. So people might have a question about this needle. There's two different types: 0.85 mil and 0.1 mil needles available. So people who has the thin skin type, we prefer to recommend to 0.85. And people who has the thick skin, we recommend the 1 mil, 0.1 mil needles. So you can either choose the 0.85 for the women's, 0.1 mil for the guys. So that's how we use. It's very simple, and just as Dr. Cho explains to you that that we have two different modes, P1 and P2. P1 mode is under fast injection. P2 is a slow injection compared to the P1. So people who has the sensitive of the pain, so we recommend the P1 because that P1 mode provides you the fast injected dose on the material. So we recommend the P1 level 4. Level 4 means we have a level 1 to 9. Level 1 as how much amount the injection amount of the REJURAN. So P1 has a 10 unit, P2 mode is a 15, P3 is a 20, 25. We already shown in the slide that the injection amounts for the levels depends on the P1 mode and P2 mode, also the level of the numbers. So just to make sure that people who has the sensitive of the pain, we recommend to go with the P1 mode with level 4, or people who has such have endurance about the pain. If you want to do the more accuracy injection, so we recommend the P2 to make sure that the liquid goes into your skin firmly. So it depends on the patient. You can either choose, or you can control the pain level. Depends on the P1 mode and P2 mode, also on the level of the injection amounts. So I hope this one to help you to understand those the BEAUMED. So it's gonna be available very soon. It's gonna be available on the end of August. So please try, and you will be you can expect a lot easier injection for any kind of our products. Thank you.